I was around 25 doing a medical externship at a clinic. Somehow I got pneumonia. I did not know I had pneumonia. I just kept feeling worse every day, just worse. And then I went, and of course I was treated. I had to stay home for I think a week, and I would look at commercials and cry. Certain commercials made me cry. I was just so emotional. I would not wish pneumonia on someone I really deeply dislike. I'll be back. Hey everyone, thank you for returning. Thank you for new listeners. We appreciate you. Let's jump into this. Since there's been a lot of talk about pneumonia, deadly pneumonia, pneumonia has been talked about in a way I have never heard it talked about. So I figure let's do a little deep dive and let's find out about this sometimes fatal infection that's circulating around in Hollywood, especially in Diddy circle. So let's get into it. Pneumonia comes in at number 8 on the list of top 10 causes of death in the U.S. The condition often goes unnoticed and untreated until it has reached a life-threatening point, especially in older patients. So what can you do? Generally, those at greatest risk for serious complications from pneumonia have a weaker immune system or condition or lifestyle factor that affects their lungs. Pneumonia is an infection of the lungs that can be caused by a variety of pathogens, including viruses, bacteria, and fungi. When you have pneumonia, the tiny air sacs in your lungs become inflamed and can fill with fluid or even pus. Pneumonia can range from a mild to serious or life-threatening infection and can sometimes lead to death. According to the Centers for Disease Control and Prevention, over 50,000 people in the United States died from pneumonia in 2015. Additionally, pneumonia is the leading cause of death worldwide for children under 5 years of age. Some types of pneumonia can be more dangerous than others, including Lobar. That's the pneumonia that has been discussed a lot, considering or circulating Kim Porter and other people that, was associated with her. Lobar pneumonia is considered dangerous because it affects an entire lobe of the lung, essentially filling a large section with fluid and preventing that part of the lung from properly exchanging oxygen, which can lead to serious complications if left untreated. While it doesn't technically affect all chambers of the lung, it can significantly impact the function of a large portion of the lung, making it a potentially life-threatening condition. Hospital-acquired pneumonia, HAP. Usually more serious than commonly acquired pneumonia because it's often caused by antibiotic-resistant bacteria. Aspiration pneumonia. A serious condition that occurs when fluids that shouldn't be in the lungs, like stomach contents or fluids from the nasal passages, enter the lungs and cause infection. The mortality rate can be as high as 70%. And I need to find out how fluids from your stomach get, I'm sure it's... Okay, let's go on. Fungal pneumonia. Often serious, especially for people with other health concerns. It's most common in people with weakened immune systems or chronic health problems. Pneumocystis pneumonia, a serious fungal infection that occurs in people with weak immune systems due to HIV/AIDS or long-term use of immune-suppressing medicine. Pneumonia can affect anyone, but there are some at an increased risk for developing a severe or life-threatening infection. People that are at an increased risk for having a serious or life-threatening case of pneumonia include children younger than 2 years old, adults aged 65 and older, people who are hospitalized, particularly if they've been placed on a ventilator, individuals with a chronic disease or conditions such as asthma, chronic obstructive pulmonary disease, or diabetes, people with a weakened immune system due to a chronic condition, chemotherapy, or an organ transplant, those who smoke cigarettes. Pneumonia symptoms may be milder or subtler in many at-risk populations. This is because many at-risk groups have a weakened immune system or a chronic or acute condition. Because of this, these people may not receive the care that they need until the infection has become severe. It is very important to be aware of the development of any symptoms and to seek prompt medical attention. Additionally, pneumonia can worsen pre-existing chronic conditions, particularly those of heart and lungs. This can lead to a rapid decline in condition. Most people do eventually recover from pneumonia. However, the 30-day mortality rate is 5 to 10% of hospitalized patients and can be up to 30% in those admitted to intensive care. Since walking pneumonia is a more milder infection, I'm going to talk a little more extensively about it. Walking pneumonia is typically a milder version of pneumonia. I think that's what I had, walking pneumonia, because I was still getting up going to work, and I had it for a minute. And so when I went and, was examined and I had to get my lungs, x-ray my lungs, and they was like, oh, you have pneumonia, I started crying. I was like, oh, my God. So let's go on. Symptoms may be similar to those of the common cold. In some cases, it can cause serious illness. Walking pneumonia is an infection that affects your upper and lower respiratory tract. It's also called atypical pneumonia because it's often caused by bacteria that, while common, are difficult to detect. Walking pneumonia is typically milder than traditional pneumonia, which is responsible for roughly 1.5 million emergency department visits annually. It doesn't cause symptoms that require bed rest or hospitalization. It might just feel like a common cold and can go unnoticed as pneumonia. Most walking pneumonia symptoms usually go away within 3 to 5 days, but a cough can linger for weeks or months. Walking pneumonia is a highly contagious disease. It can be passed to another person for up to 10 days. The disease can be transmitted when a person inhales or ingests airborne droplets released when someone with walking pneumonia sneezes, coughs, or talks. Avoiding close contact with others while recovering from walking pneumonia can help prevent the spread of pathogens. Other steps you can take include covering your mouth and nose when coughing, washing hands frequently, promptly tossing tissue in a waste container with a lid. Yeah, I just had a memory of something, or thought of something. Okay, let's go on. Let's talk about the types of pneumonia. Walking pneumonia is one of more than 30 different types of pneumonia. It can be divided into a few different subtypes, including Mycoplasma pneumonia. This type of pneumonia tends to be mild and most people recover without treatment. It's caused by the bacterium Mycoplasma pneumonia. The Centers for Disease Control and Prevention estimates that there are about 2 million cases of M. pneumonia infections each year in the U.S. Chlamydia pneumonia. This type of walking pneumonia is caused by Chlamydia pneumonia bacteria. While it can cause a serious infection, most people experience only mild illnesses or no symptoms whatsoever. It's common among school-age children and young adults. Just in case some folks wanted to know, just like I did, if the Chlamydia pneumonia is comes from chlamydia, the sexual disease? No, it doesn't. I just was like, what? How you? Okay, let's go on. Legionella pneumonia, or Legionnaire's disease. Legionnaire's disease is one of the most serious types of walking pneumonia, as it can lead to both respiratory failure and death. It's caused by a Legionella, a type of bacteria found in fresh water that can contaminate water systems and buildings. People can get this disease if they inhale airborne droplets of water that contain the bacteria. People may start noticing signs of walking pneumonia between 1 and 4 weeks of being exposed to the pathogen that caused the disease. Symptoms of walking pneumonia can include sore throat, persistent cough, headache, weakness, fatigue, fever, and chills, labored breathing, wheezing, chest pain, abdominal pain, vomiting, loss of appetite. Symptoms can also vary based on where the infection is. For example, an infection in the upper respiratory tract may be more likely to cause a sore throat, cough, and/or runny nose. A lower respiratory infection may cause symptoms like coughing, shortness of breath, and wheezing. Both bronchitis and walking pneumonia have similar symptoms, but the two diseases are not the same. Bronchitis affects the bronchial tubes, not the small airways of the lungs. Bronchitis symptoms may include low-grade fever, chest congestion, wheezing, or a slight whistling sound when inhaling, a cough with yellow or green mucus, fatigue and weakness, runny, stuffy nose, shortness of breath. The main difference is that the recovery time tends to be shorter with acute bronchitis than with pneumonia, but recovering from chronic bronchitis may take a long time. Pneumonia infections tend to peak in summer and early fall, but can happen throughout the year. Chlamydia-filled pneumonia can also cause walking pneumonia. Infections from this type of bacteria are common in all 4 seasons. It often spreads in crowded environments like college dorms and long-term care facilities. Adults and children can also contract walking pneumonia from viruses. Respiratory syncytial virus, RSV, is a frequent cause of walking pneumonia in young kids, while adults tend to get the viral form of the disease from the influenza virus. Treatment for walking pneumonia depends on what's causing the disease. Walking pneumonia from bacteria can be treated with antibiotics. A healthcare professional may use antiviral medications to treat cases caused by viruses. For very mild cases of walking pneumonia, treatment may simply involve managing symptoms at home and resting. Yes, it's possible to get walking pneumonia again, even if you recovered from a previous case. It's also possible to contract bacterial pneumonia while you have viral pneumonia. That's why taking steps to prevent the spread of pathogens is key, especially for high-risk individuals. Now let's talk about viral pneumonia. Viral pneumonia is typically a milder disease and symptoms occur gradually. However, it's important to note that viral pneumonia can sometimes be further complicated when a bacterial infection develops at the same time or following the viral pneumonia. Bacterial. These pneumonias are often more severe. Symptoms can either develop gradually or come on suddenly and can affect one or many lobes of the lung. When multiple lobes of the lung are affected, the person typically requires hospitalization. Antibiotics are used to treat bacterial pneumonia. Complications such as bacteremia can also occur. Fungal. Fungal pneumonia is typically more common in people with a weakened immune system, and these infections can be very serious. Pneumonia can also be classified by where it is acquired. Within the community or within a hospital or a healthcare setting, pneumonia acquired from a hospital or healthcare setting is often more dangerous because you're already sick or unwell. Additionally, bacterial pneumonia that's acquired in a hospital or healthcare setting may be more severe due to the high prevalence of antibiotic resistance. There's also another type of pneumonia called hidden pneumonia. Hidden pneumonia, also known as occult pneumonia, is a type of pneumonia that can't be seen directly but can be detected indirectly, often through a chest x-ray. They say usually younger, like kids and teens, get that pneumonia. The symptoms include a cough that lasts more than 10 days, a fever that lasts more than 3 days, a temperature of 39 Celsius or higher, a high white blood cell count. Radiographic signs of hidden pneumonia include indistinct pulmonary vascular markings and obliteration of normal lung soft tissue interface. The term hidden comes from the Latin word occultus, which means hidden or secret. Wow, thank you for that one. Walking pneumonia and hidden pneumonia are two different things. Well, that's what I looked up. That walking pneumonia and hidden pneumonia are two different things. Okay, so basically, like I said, I was trying to look up sinister ways that someone could give, a deadly dose of pneumonia to someone, or spread the deadly dose of pneumonia to someone, and it didn't come up. So I just decided to just grab all various forms of pneumonia and just talk about it. But basically, you just get pneumonia is very contagious. So I'm thinking however these people got pneumonia and died, somebody must have, they could have went to their home and it could have been implanted on, utensils, appliances, a favorite mug or glass they use. It's not, you don't have to be a rocket scientist. All you got to do is what you have to realize is when you have money, there's not too much you can't do. And, people can be bought all the time. And, they store these infections and diseases in medical facilities. So all you got to do is get the attention of somebody that, put money over morals or ethics. And, hey, they can give you a vial of that stuff. And you can do what you want to do with it. All you got to do is wear gloves, and maybe I'm thinking they probably infected someone's home with it, when they weren't there, gained access to the home when they weren't there, and put it in various places like on doorknobs and refrigerator handles, and common places that you're going to touch. It's a guarantee you're going to touch those surfaces. So a close friend, family member, anybody, man, please. When it comes to money, some people lose all senses of right and wrong, right? They lose all sense of right and wrong. You'd be surprised how many people turn against you for the right dollar. And some of you guys might not be surprised because you experienced it. I know I have. And they didn't even take money. These people didn't even have to be paid to turn against me. So, okay, I hope this video was helpful to you guys, and I hope you guys learned something, because I did. Thank you guys again for your time and attention, and those who rocked on through to the end of this video. I appreciate you. We appreciate you. And as always, I will see you in the next video. Have a good day, good evening, good night.